Good day, everyone. So I am Jersey Angeles once again, a nursing student from NDTC, performing the technique, transferring technique. So transferring technique, it is the use of proper body mechanics in repositioning, lifting, and transferring clients safely. The purposes are transferring technique are used to position and prepares the client for various clinical procedures. And also, transferring technique maintains and restores muscle tone. And now let's proceed to the equipments. So the equipments are uh, transfer belt, the bed, the wheelchair, or the chair. Now let's proceed to the procedure. So the procedure are first check the doctor's order and check the client's diagnosis and restrictions, and that is to determine any contraindications or limitations to the client's physical activity. Next is identify the client. Identify the client and inform the client about the desired purpose and destination. The rationale is to reduce anxiety, thus promoting client's cooperation. So, good day, ma'am. Ano pong pangalan nila?
Gian po.
So, okay po, ngayon po ay i-assess po kayo ulit ni Doc. So, kailangan po natin mag-transfer doon po sa chair.
Okay.
Sige po. So, next one is obtain, assess the client's ability, level of comfort, muscular strength, presence of paralysis, and the ability to follow instructions. And that is to provide information about the client's physical ability to ensure to secure safe transferring. So, good day, ma'am. Saan po, may masakit po ba sa inyo?
Wala po.
Hapo po dito na side.
Wala po.
Doon po.
Wala rin po.
Can you please raise your hands po? Both hands and feet po. Okay po. So the next one is wash hands. And that is to prevent the transfer of microorganisms. Next one is adjust the height of the bed to the lowest possible position. And that is to reduce the distance that the client has to step down, thus decreasing the risk of injury. Next is slowly raise the head of the bed if not contraindicated by its condition. And that is to minimize lifting and thus minimizing the discomfort for both the client and our healthcare provider. The next one is place one arm under the client's leg and one arm behind the client's back. Slowly pivot the client so that the client's legs are dangling over the edge of the bed. And that is to provide support the client when sitting him on her at the edge of the bed. Next is allow the patient to dangle for about 2 to 5 minutes. Support the client if necessary. And that is to allow time for assessing the client response to seating and also reduce possibilities of orthostatic hypotension. So, ma'am, kailangan po natin maghintay ng 2 to 5 minutes po. So, upo lang po kayo. So after 2 to 5 minutes, bring the wheelchair or chair close to the side of the bed. Place it at 45-degree angle. If the patient has a weaker side, place the chair or the wheelchair to the stronger side of the client. Rationale is to allow the client to bear weight on stronger legs. Next is lock the wheelchair's brakes and elevate the foot pedals, and that is to provide stability. Next is put transfer belt or any other transfer aid if needed, and secure it. Rationale is to provide safety and holds the patient and holds the patient without stressing its limbs or and joints. So since we don't have any available transfer belt, so let's use a transfer belt, a transfer aid. Next is lifters' knees are well flexed with back straight, while back straight, keeping the hands gripping at each side of the transfer belt. Rationale is transfer belt is grasped at each side to provide movement. Next is wrap client's body up to standing position at a count of three, while straightening hips and legs and keeping the knees slightly flexed. And the rationale is uh, rocking motion. Rocking motion gives the client a body movement and requires a less muscular effort to lift the client. So ma'am, ililift po kita ay i-rock ko po yung katawan nyo tapos ito transfer po sa chair po. So 1 2 3 go. So next is turn the client facing the wheelchair or the chair using a pivot technique while maintaining the hold at each side of the transfer belt, and that is and the rationale is less effort for the lifter and the client. So next is instruct the client to use its arm to rest on the chair. Rationale is it increases the client's stability. So ma'am, pwede pong gamitin niyo pong arm niyo para i-hold po yung chair na lang po. Yan po. Next is flex hips and knees. Flex hips and knees while lowering the client into the chair or the wheelchair. The rationale is prevents injury to client from a poor body alignment. Next is assess client for proper alignment for seating position. Support the client. Support the weaker side with pillow if necessary. The rationale is prevents injury to client. And the next is secure the security belt, uh, and secure the security belt and put the client's leg and place the client's feet on foot pedals. If the patient is sitting on a chair, offer a footstool. Offer a footstool if necessary. So footstool. Yeah, footstool.
Assume na lang.
The next one is the rationale for secure the security belt and etc. And that is to ensure clients safety. And the next one is wash hands. And the next one is record the effect of the transfer. The rationale rationale for washing hands is to prevent the transmission of microorganisms. And the next one is the rationale for record the effect of the transfer, and that is to provide accurate data in the care of the client. So thank you everyone. So that's the end of my demonstration, my return demonstration.